And we're back now at Sunday House Call. The World Health Organization releasing its annual ICD report. That's for International Classification of Disease. With all those mumble-jumble numbers, Dr. Siegel, I can't figure this stuff out. What does it mean when we see this, and what does it mean to doctors?
When you come in to see me, Eric, if you came in to see me and I said you had some diagnosis, that would be your disease. Okay, International Classification of Disease means I put down some diagnosis. This is expanding my options by about 50,000.
Oh.
And what it means is, if I say diabetes, for example, it used to be 3 or 4 codes. I looked it up this morning, over 100 codes for diabetes. Diabetes involving the retina, diabetes involving the left ankle, diabetes with kidney disease. It gives me a way to be more specific, but you know what?
Is this better?
This takes more time. It's going to lead to a lot of delays, and it's going to lead to delays in payment. Theoretically, if you got it right, if you had time to get it right, it should lead to higher reimbursements. I'm dubious, and I'm worried. Now, the CMS is saying that we have a year to get it right. We need more than a year.
CMS?
That's Medicare and Medicaid services. Okay. They're saying you have a committee for Medicaid and Medicare services. We have at least a year to get this right. It's going to take more than a year. I got a couple of codes here to read to you that you're going to like.
Oh, boy.
Here's one. Problem with in-laws is a new code.
No, seriously?
Seriously. Fear of thunderstorms.
No.
That applies to the entire American public over the last week. And here's one. Helicopter parenting. That's me for sure. And sucked into a jet engine. I saw David on a jet plane. There's a picture of him on the internet. I don't think he was sucked into the engine, though. I mean, it gives you an idea how expansive this is. It's really wild, and it's going to take a long time. Doctors that are already overburdened with record keeping are going to have a problem with this. People in private practices. Hospitals have been gearing up for a couple years on this already. They're ready. Billers are ready. Those of us in small practices.
Or insurance companies ready, though.
Yeah.
The reason why we're doing this segment is because October 1st, after years of preparation for ICD-10, we finally got hit. The hospitals are already getting ready. The doctors really have to tune in. It's a big change for us because the super bills have to change. The computer softwares have to change. A major delay in getting paid for the procedures that you do, and it's going to affect you. So when you come to your doctor's office and you're going to wait a little longer and get seen less time with the doctor, it's because of some of the changes. Purpose of the change is to be having more specific codes.
Well, that sounds good.
For example, like for fracture, you had 700 codes in ICD-9. Now you have over 1,000. For erectile dysfunction, there was 1 code. Now you have a million different type of erectile
dysfunction. Just put this in the computer and
well, that's the thing. They've got to get their systems together.
You have to know it. You have to learn it.
So the statistics shows that 25% of doctors are not prepared, and that's going to put them out of business. That's one concern. And 75% of us are only using about 10% of the codes. We like easy stuff. We're going from 14,000 codes in ICD-9 to 68,000, more complex. What does it mean for all of us, or when you come? The billers have to gear up. I think long term, this may work because it's going to better outcome, more specific outcome. The government can look who is doing a quality job. That's the purpose of this. For the time being, we have to all stick together and be patient.
You know what's going to happen? You know what's going to happen? You're going to go to the doctor. You're going to give it to the insurance, and then you're going to get a letter like a month later saying it's the wrong code.
Exactly.
You have no idea what the hell they're talking about.
Now look, here's the good. Absolutely, Eric is right. The good news is that there's going to be about 500 codes that'll end up being the biggies. We're going to have to figure them out. This is a game we play with insurance.
Eric is going to end up paying out of his pocket. When you get denial, the doctor is going to pass it on.
I know. I'm going to call you. Call them.
We'll revisit.
Eric,
let's revisit in 6 months.
Send me the bill, and I will take care of it. I'll make sure you don't get charged.
All right.